But it can be quite difficult to make the diagnosis, can't it, Evelyn, of narcolepsy? And what causes an underdiagnosis of narcolepsy and a delay in patients getting diagnosis?
Well, I think there are many reasons for this. One of them is the misunderstanding in the general community, but even in the community of physicians, pediatricians, people don't really know what it is. I've spoken to groups of school nurses, guidance counselors, school principals. Right now they know what narcolepsy is, but they say, oh, isn't that when somebody's very sleepy? So there's still a lot of misunderstanding. I think even in medical schools, I think none of us learned really what narcolepsy is, aside from maybe a little paragraph in a neurology book. But seeing a patient with narcolepsy and having this whole group of symptoms is just something that you don't really connect. And I think if somebody goes to there, even if they finally go, because it's a group of symptoms that's not always so easy. It's not like my leg hurts or I fell and my wrist hurts. It's something like people are sleepy. They're very often diagnosed in their community as lazy. Children are called, or people say, oh, sleepy, yeah, I have that too. We all have sleepiness. That's something that all of them hear. So they feel already there's a little barrier to go to the doctor with, I'm tired and I'm sleepy. They oftentimes don't connect that maybe the cataplexy is what they have, and it doesn't have to be falling down all the way, but just the head maybe a little bit, is not something they connect with a syndrome or a disorder that goes together. The hallucinations, again, is also something like that goes with crazy people, so people don't really want to talk about it. So it's very difficult for someone, if they already go to their doctor, to say all the things they have. And then if doctors don't know what narcolepsy is, they don't ask for, do you fall down when you feel emotional? Do you feel weakness in your knees maybe? Do you have crazy dreams? Do you have scary dreams? That's not something that people ask generally, let alone in a school community. School nurses don't know this at all, don't think about narcolepsy in the first place. It's a word they know now what it is, but what it really is.
And even if they do recognize the tiredness and sleepiness, sometimes they get misdiagnoses. How about in children, Karen? What are some of the misdiagnoses for narcolepsy in children?
Yeah, that's a good question. ADHD would be a common one, and some of this, with the ADHD population in particular, they're oftentimes treated with stimulants, so there's some partial improvement in the symptoms, and so the diagnosis is sort of even further confounded. I would say in the teenage population, I oftentimes see them coming in with primary depression as the cause of their fatigue or sleepiness or vivid dreams. And then epilepsy, oftentimes the cataplexy can be misdiagnosed as seizures or atonic seizures. And patients are put on medications inappropriately.
And in the adults, Alon, what's being misdiagnosed?
Sure. I'll add to what Kiran mentioned, in that children, sometimes you can see on the polysomnogram REM without atonia or REM sleep behavior disorder even before the onset of daytime sleepiness. So you have to watch for the development of daytime sleepiness later on, but there are a few reports of RBD, REM sleep behavior disorder, in the pediatric population as a manifestation of early narcolepsy, which is interesting. Again, talking about the dysregulation of rapid eye movement sleep, which both RBD, REM behavior disorder, and narcolepsy share. I do want to mention one interesting anecdote. I saw a few years ago a young girl from down in Southern California who actually presented with episodes where she fell to the ground and had the spells every time she hit the soccer ball, and got really excited and went to see two physicians, her family physician and then a psychiatrist, both of whom unfortunately did not make the diagnosis of narcolepsy, but felt that this was a psychosomatic sort of reaction to some underlying family dynamics and interestingly, she was placed on an antidepressant, which actually worked for the cataplexy, but for the wrong reason. So it talks about how the under-recognition of the key symptoms often are a barrier for making the appropriate diagnosis, and there is almost a 10-year delay from the onset of the disease to when someone eventually makes the correct diagnosis. And it is, in fact, a pediatric condition, isn't it? And oftentimes we have an opportunity really to make a diagnosis. Some other symptoms that are often misdiagnosed in adults, I would second what was already said about attention deficit hyperactivity disorder. Occasionally, though, we often see individuals who are labeled as having depression or having some sort of a irregular or underlying sleep deprivation without really recognizing that there is a little bit more to that. And I think the labeling issue is a huge problem in that we often inherit patients who were given a diagnosis, sometimes correctly, sometimes incorrectly, and it talks to the fact that we often have to validate every time we see this patient who was labeled as having a certain hyperactivity disorder or depression to just go back and re-review the symptoms to make sure we're not missing the diagnosis of narcolepsy.
How about obstructive sleep apnea syndrome? I mean, it's such a common disorder and everybody is sort of picking up on somebody who may snore. And can that be a problem with regards to diagnosis of narcolepsy?
Definitely, and in fact, obstructive sleep apnea can present with similar symptoms that folks with narcolepsy do. And in fact, when you do the test for narcolepsy, many individuals with untreated or suboptimally treated sleep apnea may have the same markers of disease severity that you see in narcolepsy. And certainly, the complication is that between 10 to all the way to 60% of patients who have treated sleep apnea are still very, very sleepy, to the point of sometimes having an underlying comorbid narcolepsy type 1 or type 2, which often complicates the picture.